Thank you, Senator. My question is about health care. I want to ask about a problem that's affecting a lot of families and will affect many more as the population ages. My aunt is 92 years old and she suffers from chronic pain. The pain is so bad. She's had operations, she's seen doctors. It just, nobody can relieve the underlying source of the pain. And the pain is so bad that she just sits all day in a chair because moving is so difficult. And therefore she's deteriorating. She's deteriorating physically because she gets no exercise. And we now know from the latest medical research that she's deteriorating mentally because exercise is the best way to stay mentally sharp as you get older. Now, her constant question is, why can't someone treat her pain so that she would feel well enough to be more active? And there are probably several reasons that the medical community is not more aggressive in this area, but one of the reasons is that the federal government has been prosecuting doctors who are extremely aggressive in prescribing a lot of pain medication for chronically, people dealing with chronic pain like my aunt. My question to you is, as president, would you be willing to reverse this policy and not simply stop the prosecution of doctors, but move the federal government in a direction of actively encouraging aggressive management of pain so that people like my aunt aren't suffering in their last years?
First of all, our sympathy to your aunt, and we hope she finds and can obtain relief from the pain that she's undergoing. Dr. FRIST is here, who is a practicing physician and surgeon, as you know, one of the great heart surgeons in America. I know that he's been exposed to a lot of people who suffer from this chronic pain. I think he would agree with me that these charges aren't brought unless there is overwhelming evidence that that physician has abused the Hippocratic oath that requires them not to do things which may in the long term impair their health. And I can't tell you exactly which one, but they're also exposed to a jury of their peers, and on a rare occasion, maybe Bill, maybe you could say something about it.
You know, I think what you do bring up is what Senator McCain talked about at Cleveland Clinic about 6 weeks ago, and that is chronic disease. And the whole chronic disease, of which pain and chronic pain is one of those, has got to be the focus as we look ahead to healthcare. It's really the centerpiece of what Senator McCain talked about. In terms of the specific approach, it means we have to continue to invest in science and being able to figure out exactly what to do in terms of what tools that we have will most effectively treat that sort of pain. And again, it goes back to Senator McCain's strong support, both in the past and in the future, of continuing to invest in science so that we can answer your question in an intelligent way without unnecessarily prosecuting people and punishing them.